Thank you all for being here today. My name is Kim Bellamy, and I serve as lead strategic programs and partnerships within equity, diversity, inclusion at the Association of American Medical Colleges. It is an honor to moderate this panel today and to be invited into this space with you all. I am not a member of the American Indian or Alaska Native community, but I felt nothing but community since I began working on this initiative since its inception, really. One of the things that our keynote presenter asked us to focus on today was analyzing what is iHeart rooted in and our mission. And one of the things that came to mind for me is that we are working to advance representation of American Indian and Alaska Natives, not only within medicine or nursing, but across the health professions. So we are very blessed to have all of our speakers today who represent a range of different health professions, including veterinary medicine, osteopathic medicine, as well as dentistry. Prior to our panelists speaking, I just want to share a quick outline of how we're going to structure our session today. So each one of our panelists will have the opportunity to present for about 15 minutes or so following a quick introduction. Following that, we're going to do a round of collective moderated Q&A, and then we're going to open up for questions from you all. So if anything comes up or resonates with you, please feel free to share your questions in the chat, and I will do my best to make sure that those are addressed towards the end of our session today. So first, I would like to introduce our first speaker, Dr. Rance McClain, and I am going to share my screen so you all can see a presentation here.
All right, Kim, are you ready for me? Or...
Here it is.
There we go.
Okay. And here we are. All right, so Dr. Rance McClain, DO, as Senior Vice President of Medical Education, leads all aspects of AACOM's Medical Education Department, including development of AACOM strategic plans, goals, and objectives in these areas. Dr. McClain works with AACOM's member colleges, the AACOM Board of Deans, and external partners to develop and manage initiatives that improve the quality and future models of medical education across the full continuum of medical education to improve the health of the public. So now I will turn it over to Dr. McClain.
Thank you so much, Kim. And let me, if I can, bring up my presentation and share that. Hopefully everyone can now see that. And again, as Kim said, I am the Senior Vice President of Medical Education at the American Association of Colleges of Osteopathic Medicine. So anytime I talk to a group such as this, I never make the assumption that everyone is aware of what osteopathic medicine is. So I want to start off with just a little background on the profession, where we are, what we do, and kind of level set for everyone to get everybody on the same page. So with that, question always comes up. I still get asked this all the time. What is osteopathic medicine? And our profession has been around for a little bit over now 150 years, formed by a frontier physician, Andrew Taylor Still, in 1874. He was also a territorial legislator, an educator, as one of the founders of Baker University in Baldwin, Kansas, and worked within the Civil War as a medic in the Civil War and took care of patients after that. And one of the things that really brought the profession forward was the unfortunate death of his wife and 3 children in 1864 for spinal meningitis. And he took a step back and looked at the care that was being provided at that time and came to believe that there had to be a different approach to providing medical care, one that was more holistic and one that was based more in the history of medical care versus the concentration on medications at the time, many of which we found out, of course, years later, were very detrimental. So he started studying ancient medicine and really came to believe that the structure of the body was vital to optimal health. And that's where the name osteopathic medicine came from, with osteo being an origin of bone and pathos, a condition or suffering. And he took these beliefs as well as his beliefs in lifestyle medicine, and eventually, within a few years after developing this, moved from Kansas up to Kirksville, Missouri, where he founded the first school of osteopathic medicine, the American School of Osteopathy. And this is A.T. Still, one of the pictures that exists of him. And one of the things that our profession is very proud about with its history is the relationship of the tenets of osteopathic medicine to the historical practice of medicine, which, as we've come to find with a lot of indigenous populations, had similar practices within their own healing communities, and the view of the body as a unit, and that each person is made up of a body, mind, and spirit that overall works to help govern their health and their well-being. We also believe firmly that the body is capable of self-regulation, self-healing, and health maintenance. This is evident, if you get a cut will scar and the scar will heal. The body heals itself. And much like, when we have blood pressure issues and things like that, our body fights to regulate itself, but sometimes it struggles in that fight. And all of these concepts that are, if a person leads a healthy lifestyle and maintains a healthy body, the body will do the majority of the work to regulate itself. And then the third tenet is structure and function are reciprocally interrelated. So as you have optimal structure, you will have optimal function. And that these two, that if one suffers, there's going to be an impact elsewhere. And then finally, that rational treatment is based on these principles. And that's what the practice of medicine should be, to seek good health and a strong body, mind, and spirit. From the early days of osteopathic medicine, before the turn of the century, Dr. Still, we're proud to say, also supported equality. And this was evident by there being female representation in the very first class at ASO. And this picture is of Jeanette Bowles, who was the first woman to receive the osteopathic degree as she graduated from the very first class of osteopathic medical school. The other thing that Dr. Still and the profession believed in from the early days was equality across race and ethnicity. This is Dr. Meta Christie, who was the first African-American DO who graduated from the Philadelphia College of Osteopathic Medicine in 1921. These are beliefs that our profession has held dear to us from the earliest days of the profession, that osteopathic medicine should be a pathway to becoming a physician for all people, regardless of any aspect of their background, which is why I'm very honored to be here today and to present as part of our profession to this group. So where does our organization, AACOM, fit within this, in the osteopathic medical profession? Well, there's two basic components within the osteopathic medical profession. There's the education system, and then there's the practice-based system. And there's two main organizations that work in this realm. AACOM is the organization that helps coordinate and oversee the education system. So we produce the medical school graduates that go out into residency training. And during residency training is when our work starts to really overlap with the American Osteopathic Association, whose primary function is to work with the practicing osteopathic physicians. So at AACOM, our mission and vision goes all the way back to the early days of the profession. AACOM was formed over 125 years ago in the late 1800s to be that leading voice for education and support our member institutions, our colleges of osteopathic medicine, and work with efforts to attract and train future physicians who really want to make a difference, treat the whole person, and build a future of health and wellness for all people. I'm happy to say that at this time, we have expanded to 42 campuses and now 68 teaching locations across the United States. To put that in perspective, I went to school in the early 90s, and at that time, there were 15 campuses at 15 locations across the United States. So it shows you how rapidly our profession has grown in an attempt to help fill a void in healthcare in America. And this is a map of our current location, and this was not used with MapMe, but I do love the fact that, Stephanie, that you presented that map, because I can envision a day where we can compare our osteopathic medical education map with your opportunities for education and resources for education map and see a huge amount of overlap, because I think these can give us a visual representation of potential partnerships between organizations to help create strong pathways for your community to grow and join our community and become future osteopathic physicians that can be trained to go back and provide care within the Indigenous communities. So our mission, again, is to lead and advocate for osteopathic medical education and improve the health of the public. And we do this by supporting those colleges that I referenced and also increasing awareness of osteopathic medical education as an option for those who want to pursue a career in healthcare and particularly as a physician, promoting excellence in medical education, but also with policy, research, and service within medical education, and then fostering innovation and quality through medical education. And our values that we hold dear to us, I won't go into detail on these, I'll let you see them though, are collaboration, empowerment, you can see inclusion is one of our core values, responsiveness, and service to all our members and also the public. So with AACOM and osteopathic medicine, I was asked to present a little bit of data and some places where we see some our current structure of what we are as a profession, and then I'll lead that into some of our efforts that we have going on right now. And the most recent total data numbers came out last year in 2024, and I'm happy to say we are closing in on 200,000 direct members of the osteopathic medical community. And when I say direct members, that is looking at practicing osteopathic physicians, or DOs, as our name is, as well as students in osteopathic training. And because of that rapid expansion of our profession, it's not surprising that 69% of practicing DOs are under the age of 45. So we have a relatively young practice base out there when you consider that most physicians do not enter their true clinical practice until usually sometime around their late 20s at the very earliest to their early 30s. And they often practice well into their 60s or 70s. To have that shift be under 45, we consider ourselves still a very young profession, or the heart of our profession is the youth of our profession. When you look at osteopathic specialties, though our physicians do go out and practice in all aspects of medical care, the majority do pursue careers in primary care, and about 57% are in what we call pure primary care specialties, such as family medicine, internal medicine, and pediatrics. Once you get outside of that, the next largest groups are also ancillary primary care specialties, things like OBGYN, and psychiatry and emergency medicine, general surgery, which are often also first-line specialties in medical care for people, and are kind of in this area between specialty medicine and primary care. That brings the number up to the high 60s, nearing 70% of our physicians are in those specialties. Then the remainder, again, practice out across all specialties: orthopedic surgery, otolaryngology, or ear, nose, and throat, plastic surgery, neurology, all of the other specialties that are within the house of medicine. When we look at the pipeline of applicants coming into osteopathic medical school, of course, it varies from year to year, but we've had a relatively steady upward trajectory. During the COVID times, all health professions saw a bump in applications and then a subsequent decrease in applications. But historically, when you look at the last handful of years, we are around 23,000 applicants a year that are applying for admission to the roughly 1,000 or 10,000 first-year medical school seats within our osteopathic medical schools. Of this, when you look particularly at the American Indian Alaskan Native population, in 23-24, in the academic year, we had 107 applicants admitted. So unfortunately, I'm here to say that's only 1% of our medical school admissions were identifying as purely American Indian Alaskan Native. We do have another category that has multiple, is somebody who has, say, Alaskan Native heritage, but also has Hispanic or Caucasian white heritage. They would fall under a other category or multiple category. So we know this isn't the pure true numbers, but either way you look at it, this is an area that we as a profession would love to address and love to increase that representation within our communities. And we'll talk about some ways in which we are trying to do that. Move this on. Oops. So that gets me to this section, and to talk just a little bit about what's going on within osteopathic medicine currently that we're doing to try to change this. And one of the shining examples of this is our profession cannot say to the extent of how proud we are of what has occurred with Oklahoma State University and their College of Osteopathic Medicine in establishing the first tribally affiliated medical school in the United States. And as hopefully you're well aware, in 2020, AACOM opened up a campus at the Cherokee Nation in Tahlequah, Oklahoma. And again, this was the first tribally affiliated medical school in the United States. But it's not just the location of this campus that is important. It's the things that they're setting an example for the rest of the profession as a way in which education can be tailored to the communities in which it serves. By integrating Cherokee culture into the curriculum and the development of tribal medical tract, which prepares students for primary care residencies in tribal or tribal-focused healthcare facilities. I have known the dean of the campus at Cherokee Nation for many years, Dr. Natasha Bray, and that is her on the bottom right there during the white coat ceremony, where the students are entering their medical education in a ceremony where they don their white coat. And I've had many opportunities to talk about the things that they're doing, and not just what they're doing now, but their plans to continue to grow and focus in the future, those efforts, and not only keep them within what they're doing at Oklahoma State, but use them as an example of potential other partnerships that medical schools can have moving forward. Another area in which we are involved is within the AIMS Alliance, or the American Indian Medical Education Strategies Alliance, which was just recently formed a year ago. Its current makeup is 25 tribal organizations, medical schools, health plans, and other stakeholders, but rapidly growing. And in my work with Dr. Bray that I mentioned before, the dean at Oklahoma State, they got in and involved in the AIMS Alliance right away. And she encouraged them to reach out to AACOM. And it took all of one phone call with a couple of follow-up emails to get AACOM on board, because the messaging that we received resonated very much with what we as a profession know that we need to be involved with. And the mission of this organization is to try to address physician shortages in tribal communities, but not from the medical education standpoint in the 4 years of medical school, but working on policies to expand graduate medical education, or GME partnerships, both in urban and rural tribal medical facilities. And with this, hoping to improve healthcare access and promote culturally relevant physician training, because it's not, again, just the location, it's what's included within that training. So below here is a picture of a group of AIMS Alliance folks, and hard to see, but I'm in there somewhere, but this isn't about me. I was just happy to be there in Washington, where we worked with politicians and people that we could get their ear to talk about how important of an issue this is. And AACOM wanted to be involved so we could get our colleges of osteopathic medicine involved as well with this, to help partner with these facilities to develop graduate medical education that would keep students in these communities to provide care. We know as a profession that if a medical student goes to school and then does their graduate medical education training in a region, they are 70 to 80% likely to remain right there in that region providing care in their career. So when you base that medical school and those training programs in a tribal community, we know that that's going to increase the number of physicians caring for those communities. So a very vital component to this whole pathway to practice that we're involved with. And then finally, there are multiple colleges of osteopathic medicine that have implemented pathway programs in collaboration either with high schools or undergrad universities in their region that focus on encouraging American Indian Alaskan Native students to pursue medical careers as well as other healthcare careers. Again, we would love to see them enter medicine, but most importantly, we want to see a depth and breadth of healthcare providers across the spectrum. So, you know, we have so many different comms that are actively involved in this on their local. I couldn't even put together a list that comprised all of them. And then another thing that has been developed, A.T. Still University, which is the evolution of the American School of Osteopathy in Kirksville, Missouri, the very first school of osteopathic medicine, has also established the National Center for American Indian Health Professions to support the community as well, offering things such as career advising, admissions assistance, financial guiding, and mentorship to potential applicants to the healthcare professions. So with that, I want to thank you for allowing me to be here as I stop sharing my screen. And again, very proud to be presenting to this group, and look forward to the other presenters, and then sticking around and having some time to interact and answer additional questions.
Excellent. Thank you so much, Dr. McClain. So next up, we have Dr. Greenhill. Let me share my screen again, more promptly this time. Dr. Lisa Greenhill originally joined AAVMC in 1996 and has worked for the association on 3 separate occasions. Most recently, she joined the AAMC in 2004 as the Associate Executive Director for Institutional Research and Diversity before becoming Chief Institutional Research Officer. Her work primarily focused on the ongoing development and implementation of the Diversity Matters initiative at the national and local levels, as well as promoting the veterinary medical profession within underrepresented and marginalized communities. Lisa or Dr. Greenhill also directs the association's national research agenda. Previously, she worked as a research associate at the American Indian Higher Education Consortium and as the legislative manager for the Association of Women's Health, Obstetric, and Neonatal Nurses. Welcome, Dr. Greenhill.
Thank you so much. It's a pleasure to be here. Let me see if I can share my screen here. Hopefully that is showing up. Okay, all right. Great. Thank you so much. Really a pleasure to be with you this afternoon. Bring you greetings from Washington, D.C., but also very personally from, I am a descendant of the Chickahominy and Pamunkey tribes here in the Mid-Atlantic region. Both of my grandmothers are with me in spirit and certainly passed that lineage on to me. So it's always a pleasure to talk to and reach out with my community. So with that, I want to start with a brief introduction for the AAVMC, very similar to AAMC, but much, much smaller and with veterinarians. And so our mission is to inspire innovation and promote excellence in academic veterinary medicine worldwide. We are a global organization, unlike some of our partner organizations featured here on this call and within the health professions education community writ large. And we kind of focus our work on these 3 areas. We analyze, catalyze, and advocate. And so we see ourselves as really kind of the home for that institutional research that and our research agenda that I oversee here at AAVMC, which is really kind of the hub for a lot of what we do in terms of trying to certainly advance our mission, but also tell the story of academic veterinary medicine. In Catalyze, we bring our members and many others together, and we are always doing outreach to really try to coalesce the academic veterinary community. And then finally, we do a lot of advocating, certainly both in with respect to federal legislation and those types of things, but also really kind of just thinking about ways in which we advance the interest of veterinary medical education writ large. Very similar to my colleague, our values really center on integrity, service, diversity, inclusion, and excellence. Our membership is comprised of accredited colleges and schools of veterinary medicine in the U.S. and abroad. We currently have 35 colleges of veterinary medicine in the United States. 2 of those will actually be are in the process of admitting their first classes now. A new school in Rowan University, excuse me, in New Jersey, and then a school, I think it's Ana Martinez in Puerto Rico. And then we also have 21 fully accredited international colleges of veterinary medicine from the UK, the EU, Korea, Australia, New Zealand, the Caribbean, and Mexico and Canada. And then we also have a tier of membership called provisional. We are experiencing a period of pretty dramatic growth. This doesn't happen that often in a lot of these health professions. We kind of see big growth in terms of the numbers of schools. But the last time that we've experienced this type of growth was probably sometime in the 1980s. We have 21 institutions both domestic and international, that are currently kind of somewhere in the pipeline on the path towards accreditation. About 10 of those schools are in the United States. And some of them are in the Southeast, the East Coast, but more of them are kind of in the Western to Midwestern region. And then finally, we have a tier of membership that includes departments of veterinary science, which typically we would find in schools of agriculture, or comparative medicine, which we would find in schools of medicine. So I joined AAVMC for that third time, as Kim mentioned, in 2004. And 20 years ago, in 2005, we launched the Diversity Matters initiative, which was a really concerted effort for us to try to work on not only improving the relative kind of racial representation for underrepresented and marginalized communities, but also thinking about the ways in which we educate our students to make sure that they actually have the competencies to work in a broad array of communities, and also kind of finding ways of infusing the curriculum, not only with that kind of cultural competence and cultural humility, but also whenever we can, helping students to understand the various ways in which people kind of think about medicine, think about healing, think about all of those types of things. And while I'm showing US data, we find that a lot of our institutions outside of the US are actually doing far better than we are. We actually have a school in Australia, University of Sydney, that has a whole population, has a whole center for Indigenous veterinary study. They have mandatory clinical rotations for their veterinary students to go out in the bush and work with Indigenous and Aborigine populations in Australia. And so over the last 20 years, as you can see in the graph, we've seen a pretty dramatic increase overall in terms of racial and ethnic diversity within our student enrollment here in the US. But when we peel the layers back, I am, not gonna lie, the numbers are terrible. The numbers are absolutely horrible. Currently, the data show that in terms of professions, we have fewer than 100 DVMs who identify as American Indian or Alaska Native practicing in the United States. And within academic veterinary medicine specifically, we only have 18 individuals, and you can see the roles that they serve in there. Dr. Evelyn Galbin is one of these individuals. She is a tenure track faculty at University of Penn, a neurologist by training. And so, I'm not gonna lie, we have an enormous amount of work to do. And certainly we face a number of challenges that are certainly similar to what we would see certainly in osteopathic, allopathic, and probably dentistry as well. But there are some unique challenges, I think, that we experience in veterinary medicine. Here's that kind of racial breakdown for that for our student population. Currently, it's about 1.1% of students identifying as American Indian, Alaska Native, and that actually equates to about 100 students this year currently matriculating in schools of veterinary medicine. So some of the things that we've been doing is we've been trying to increase our presence in some of these spaces. Certainly, we've been trying to kind of develop a presence by sending some of those faculty to the ACES meeting. But over the last probably about 18 months, I've been doing a lot more work with our member institutions around rural recruiting. We have certainly, like other disciplines, there is a real shortage of healthcare practitioners in rural communities, particularly. And in veterinary medicine, we also have, at least at the student ranks, well, also at the professional ranks, women have now outpaced men dramatically. And so our student enrollment is about 82% women, and about 16-17% male identified, and the rest are folks that identify typically as non-binary and or trans. And what we kind of hear a lot of pushback in is we want more farm boys. And the image that you see on the screen is really kind of what people envision. And so despite all of our efforts to really try to educate not only our member institutions, but the profession writ large around what recruiting should look like in rural communities, we are really bumping up against this very strong kind of mental anchor around what that visual looks like and who lives there, and what the possibilities are. There's also, beyond that, just some real challenges around lack of inclusion. I can tell you that this profession is pretty conservative. So a lot of the discourse that you are kind of seeing in our everyday news now, we've been seeing for a number of years. We kind of saw this coming. But there's also a real lack of appreciation for the barriers in recruiting in some of these rural communities, and particularly in Indian country. And, I was at a meeting in January with our leader deans, and, I talk about some of the challenges in terms of access to schools. What does it mean to kind of send strangers out to these communities? All of these kinds of things that are really, really meaningful can have a very positive or negative impact on recruiting. And they're like, those are social issues, Lisa. We can't fix those. But if we just keep doing what we're doing, and I'm like, what you're doing is not working. So, let's really kind of think about trying something different. And so this is one area that we really are struggling with in terms of how do we think about and envision the future of recruiting in veterinary medicine. I shall also note that this is a profession that has only really kind of started to pivot towards recruiting in the last 15 to 20 years or so. This is a profession, certainly I think all health professions have the little kids that are like, I want to be, X, I want to be a doctor when I grow up. But certainly the data show that more students than not typically will say that they're very interested in veterinary medicine under the age of 10. But we lose a lot of those students for lots of different reasons, in the inaccessibility of veterinary healthcare in these spaces, and the lack of understanding that it is a medical discipline, very much like the others, that requires a lot of that similar participation. So some of the things that we've really had to do in the last decade or so is just raising awareness within our community, even as we're kind of looking inward and facing out. And so, I host a podcast at AAVMC. It was called Diversity and Inclusion on Air. We're just happening to rebrand anyway, so it will be called On Air, AAVMC's On Air moving forward. But we've had certainly a number of guests from the Native American Veterinary Association, Dr. Gilbert John from Colorado State University's Veterinary School, and again, Dr. Galbin from UPenn. We've hosted Indigenous Peoples Film Festival, again, trying to help people understand what some of the issues are with Indigenous populations here and abroad. We spent a lot of time on the movie, the documentary that's on Netflix called Gather, and trying to help and kind of map on within veterinary medicine what is our role, both professionally and ethically, in terms of really digging in and supporting the return of the buffalo, supporting issues around food sovereignty. I do a lot of support with the affinity groups. Again, when we're talking about the numbers that we have in vet med, these groups are really, really small. One of the things that I was really interested in is getting these two groups to merge, because there's really just hardly enough people to have two separate affinity groups. but there's still just so much work here to do. Some of our challenges include, you know, when the numbers are low, there is such a heavy reliance on the few as visible voices. And we do have a lot, well, not a lot, but again, those numbers are small, but we do have House officers that are certainly in the pipeline. But, you know, as much as we want them to be out front and be very visible, we really also want to protect them as they're doing their training, as they're seeking tenure, as they're kind of getting stable in their careers. We don't want them paying that extra diversity tax because they're one of the lonely onlys, right? And so because of that, then we actually have so few visible role models. And so we're always kind of bumping up against the issues around trying to include and promote folks, but also protecting individuals in terms of getting to a place in their career where they actually will have more time to be visible and out in the community. And then again, reminding ourselves about those key issues that intersect with the profession, and also kind of thinking about the ways in which we can do more outreach and providing not only service, but also visibility and recruiting through, you know, there are quite a few veterinarians that work for the Bureau of Indian Affairs on tribal lands, those types of things, and really trying to connect with those folks to implement role modeling programs that we have at some of our schools, like Purdue University. And then, of course, there's always that limited resources for recruitment and outreach. This is not something that Vet Med has historically had to fund because there was always a glut of applicants. And while we still have many applicants, and we're Rance, we're one of the few health professions that have not seen a decline in the number of applicants since the pandemic. Our numbers continue to go up. We are still very concerned about how our colleges even think about recruiting, because it's just something that, frankly, the skill set seems just bizarre to them, because they're like, why would we do that? We have enough students. And I'm like, but do we have all of the students that we need? Are we really looking to the future in terms of how we intend to best serve society, and making sure even that the students that we have are actually prepared to work in diverse communities, to work on tribal lands, to actually build relationships? Are we ensuring and cultivating the skills necessary to be successful in those endeavors? And then, of course, I was here for the end of the previous session. There is now, of course, the fear of federal intervention, and so many of our schools have pulled back. Up until a few weeks ago, I was our chief diversity officer, and I had to relinquish that title, not because we received funding, but because we wanted to make sure that our member institutions could actually still access our programs and services. And so I think I'll end there and leave time for questions. Here is my contact information, and feel free to reach out. And I'm very, very pleased to be with you this afternoon.
Izzy, can you put us back, or there we go. Kim, since we have a few minutes for questions, can we go back to full screen with all our members?
Yes, we have one more presentation.
Oh, okay, go ahead.
Okay, so our last presentation is with Dr. Jessica Rickert. I'm going to bring up her bio. All right, so Dr. Jessica Ann Rickert, DDS, is the first female American Indian dentist in the world, graduating from the University of Michigan School of Dentistry in 1975. In 1975, she established a private dental practice. She also provided dental care for the Children's Aid Society, the Department of Corrections of the State of Michigan, the Michigan Community Dental Clinics, and the Family Health Care Organization. Dr. Rickert has many published works, including the book Exploring Careers in Dentistry, and articles published in journals of the Michigan Dental Association, the Arizona Dental Association, and the American Association of Women Dentists, to name a few. She has also earned multiple awards for her work in dentistry. She has served on the Michigan Urban Indian Health Council Board of Directors and the Board of Directors of the Society of American Indian Dentists. It has been her honor to have spoken in many national venues, including universities, major corporations, and professional summits and organizations. Currently, Dr. Rickert is the Anasha Bay Outreach Specialist for the Delta Dental Insurance Company of Michigan. I'm sure I may have butchered that a little bit, although I practiced it. So please correct me once you begin to speak, but please welcome Dr. Rickert.
Hello, I am a member of the Prairie Band Potawatomi Nation. The Potawatomi are a part of the Great Lakes tribes. We call ourselves the Anishinaabe. The Anishinaabe use the medicine wheel to describe our life cycles. The medicine wheel is divided into 4 sections, and I have used those 4 divisions in the Anishinaabe Dental Outreach. The first division is healthy teeth. The second division is a healthy person. The third division is a healthy tribe. And the fourth division are healthy Anishinaabe. I have been in private practice, as Kimberly has mentioned to you. So I am not an academician. So I'm going to speak about our efforts in the state of Michigan. In the state of Michigan, we are trying to elevate the education regarding dental health for our 12 tribes and for our urban Indian centers. By doing this, we want to improve the dental health and the overall health of our 12 tribes in the state of Michigan and our urban Indian centers. We want to recruit the Anishinaabe students into the 5 dental careers. The first is a dentist. That's my main goal. We need more dental hygienists. We need more dental assistants. We need dental technicians and dental therapists. We also are educating the general Michigan population about the Anishinaabe, that we have been here for over 12,000 years, and the time from 1492 to now is actually short compared to that long time span. So we have contributed a lot to Michigan, and we still have a lot to contribute to Michigan. I also want to recruit dental professionals, the 5 professionals I mentioned to you. I want to recruit them to work at the Michigan Tribal Dental Clinics. 10 of the tribes in Michigan do have their own dental clinics, and right now one of the urban Indian centers is trying to establish a health clinic. Geographically, Michigan is divided into 2 peninsulas. We are surrounded by water. We are the Great Lakes state. So that makes our travel between the peninsulas difficult, although now we have the Mighty Mac Bridge. So come on up and visit. I think you'll enjoy seeing it. In Michigan, there are approximately 60,000 Anishinaabe, but there's not only Anishinaabe, there are American Indians and Alaska Natives from the whole country that have come to Michigan. They came here to work in the automotive industry and in other automotive industries over the past centuries. And of course, they've stayed here, and they're established residents in the state of Michigan, and their families are still here. In Michigan, there are 2 dental schools, a public university at the University of Michigan and a private dental school at the University of Detroit Mercy, which is a Jesuit school. There are 1,012 dental students in the state of Michigan. Of those 1,012 dental students, 3 are American Indians. There are 11 hygiene schools in Michigan, and there are 9 dental assisting schools in the state of Michigan. There is only one opportunity in the Upper Peninsula of Michigan for dental training. And that is a recent collaboration initiated by the Anishinaabe Dental Outreach, whereby the first year in a dual enrollment program, the first year of a dental assisting program is completed at the Bay Mills Indian Community College, and the second year is completed at the Northwestern Michigan College Dental Assisting Program. Dr. Greenhill talked about the difficulty reaching out to rural communities, and that difficulty is 10 times harder in the Upper Peninsula of Michigan. So we have several large cities there, and quite a few Anishinaabe people live there, and quite a few tribal reservations are there. So we need to really reach out to them and make sure that they are taken care of. I was the only American Indian dentist in Michigan for over 45 years. Currently, there are 3 American Indian dentists in Michigan at this point. So we're hoping that there will be more in the future. To address the workforce recruitment initiatives, the Anishinaabe Dental Outreach is sharing the educational requirements to the Native students in Michigan schools, K through graduate school. We are sharing the educational requirements with the Native American Student Association and their advisors at the 3 tribal community colleges in Michigan and the 3 tribal charter schools in Michigan. We are also sharing these prerequisite requirements with the universities and the colleges in the state. As the osteopathic doctor and the veterinary doctor spoke, the prerequisites for dental school, medical school, nursing school are somewhat similar. So we try to let them know that if they will fulfill those requirements for dentistry, and maybe they find out that's not something they want to do, they have the option of entering other health professions. We also have realized we have to reach down to the middle schools and the high schools, because sometimes I will talk to an Anishinaabe young person, maybe 20, 21 years old, and they're interested in dentistry, but they haven't taken the necessary classes even in medical school or high school. So in reality, for them to meet the prerequisites to go to dental school is out of the question. So we do reach down to the middle schools and the high schools, especially where Native students are attending in larger numbers. We participate in their career nights, and February is Give Kids a Smile Month. So we go into the schools and we teach them about dental health, and we also have a portion of that program called See Yourself as a Dentist. And of course, it's quite simple when you're in 6th grade or 4th grade, but as time goes on, as you get into higher grades, then we make that more involved and more detailed. We are working with the Confederation of Michigan Tribal Education Departments and the Michigan Indian Education Council. They have taken our career information, and when they talk to their students, they are now very emphatically mentioning dentistry as a possibility. They did not mention dentistry as a possibility. They did mention health careers, but not specifically dentistry previous to our outreach. We also have attended tribal and American Indian Alaska Native Urban Center career nights or health fairs. We are educating the Department of Education in the state of Michigan about Anishinaabe-Mowen dental efforts. We have taken dental information and dental education, and this has been translated into the Anishinaabe language by our expert, Kenny Pheasant, and these posters and handouts are used throughout the 12 tribes in Michigan and the urban Indian centers. We are working with public museums in the state of Michigan encouraging them to recognize November as National Native American Heritage Month, and also to recognize February as Give Kids a Smile Month. And there's been several museums in Michigan who have really jumped on the bandwagon, and they have done excellent exhibitions on dental health and specifically on dental careers. And the Grand Rapids Children's Museum currently has Give Kids a Smile exhibit, and they have a wall called See Yourself as a Dentist. I helped them develop that. And on that wall, they have the pathway, the description of the dental careers that I mentioned earlier. They have that in the Anishinaabe language at the Grand Rapids Children's Museum. We do attend powwows, and we set up a dental table. It's very popular. At the dental table, we give away toothbrushes, toothpaste, floss, books, toys, coloring books, reading charts, and access to free dental education materials. We also display the Rethink Your Drink exhibit, encouraging the attendees to drink water and to avoid sugary drinks. As a call to action, we are using the role model posters, which were developed by the University of Nebraska Medical School. These posters are free. This series is free, and it features many successful American Indians and Alaska Natives in many professions, including osteopathic medicine and including veterinary medicine. This link to this website where you can obtain this free resource is available. Kimberly will be making that available to you. In February, we launched the Chairside Dental Hygienist Recruitment Program in 9 states, including Michigan. We offered a free training to hygienists, and we had 20 hygienists from these states respond. Although this is a little disappointing, we would have liked to have more hygienists. There is one hygienist in Michigan who is promoting this at the Nottawassippi Huron Band of Potawatomi Dental Clinic. What this Chairside recruitment program does is, as the hygienist talks to the patient and patient's parents and grandparents, the hygienist mentions dental careers. And in the items that are given away, the toothbrush, the floss, the toothpaste, she gives them a pamphlet, a brochure with a QR code that explains dental careers, specifically hygiene careers. And at a later date, they can look at that QR code or at the brochure, and they can find out how to become a dental hygienist. And that has just started less than a month ago. And this was developed by Delta Dental Foundation. And Holly Seabury is on this conference call with me, and she was very instrumental in developing this program, and she will share the link. There is a link to this program, how to become a Chairside ambassador for dental hygiene. Now, just as information for you to know, the Kellogg's Foundation is located in Battle Creek, Michigan, and that foundation, along with the Pew Foundation, are pushing the dental health therapist program nationally. There are no dental health therapists in Michigan so far. The Michigan tribal dental clinics cannot fill their dental workforce. This is started during the pandemic, and it's only gotten worse. In fact, there's beautiful dental facilities in certain dental, at certain tribal dental clinics. They're beautiful. They have the latest technology and equipment, and they are not seeing patients because they don't have a dentist in that clinic. Of course, this results in less than ideal care for our tribal members. And the Indian Health Service on a national level, they cannot fulfill their dental workforce requirements either. So this chairside hygienist recruiting program is a very innovative and very necessary way to reach more people, not just Anishinaabe people, but to reach many people to consider a dental career. I have found that private businesses and organizations have been very responsive. They always offer to help. They very seldom say no, and this includes the Henry Schein Dental Supply Company, Colgate-Palmolive Company, and Delta Dental Insurance. And there's many other dental organizations and businesses who have helped with the Anishinaabe dental outreach. Efforts to engage dental educators at the dental schools in Michigan to reach out to Anishinaabe students has had very limited success. The American Dental Association and the Michigan Dental Association do include American Indian Dental News in the recent years, and they are both willing to reach out to the Anishinaabe population in Michigan, especially with career information, and especially with Give Kids a Smile Month in February. They offer many free dental education materials. Usually you do have to sign up for that in November. February is Give Kids a Smile Month. The Society of American Indian Dentists has many dental programs. This society is most active in the Southwest, where there is a large American Indian Alaska Native population. They do not have a very significant outreach to the Great Lakes region. Through the Northern Plains hub of IHEART, we are making the above dental information available to all. So I thank you for your attention, and I thank you for this opportunity to share our Anishinaabe dental outreach. And remember, keep smiling. That's all.
Thank you, Dr. Ricker. And you have me smiling right now. So thank you for that wonderful presentation. I'm just going to remind all of our attendees that we're going to be moving into audience Q&A in just a few moments here. So make sure that you include any questions you have for any of our three panelists in the chat, and I'll be sure to get to those. I'm just going to go over a few pre-prepared questions in the meantime, while you all think of any additional questions that you may have. Dr. Ricker, I hope you didn't go too far, because my first question is for you. So you mentioned so many different strategies that have been implemented at the state level. And I loved hearing about all of those, as well as the resource that you shared. I'm just wondering if you had to identify any specific strategies that were mentioned that can be replicated across other states or other regions, what would be I guess maybe the top 2 or 3 that others can maybe try to implement within their respective areas?
Well, I know that there's, I believe there's 55 dental schools in the United States. So you can approach the dental schools and ask them if they have educational outreaches, and they could help. I'm specifically talking about becoming a dentist, but there are, like I mentioned, hygiene schools and dental assisting schools, and most states have a dental association that can give you those names of those schools. And so you can reach out to them and see if they have materials that they can give to you. I have found that it is most important to ask. If you keep asking, you might ask 10 organizations or schools to help you, and maybe 8 will not be responsive, but 2 will be. So just latch on to those 2. For example, the Grand Rapids Children's Museum, I mentioned that. So that has snowballed to other universities, and other museums have seen what they've done and they like it. So that, just keep asking, just keep reaching out, and like she asked me about the translations, and I do not, unfortunately, I don't know the language. I don't speak Anishinaabe-Mowen. And of course, I immediately said that to her, but then I can direct her. So it's just surprising how once you start that there is help out there, and just keep asking and just keep going. That's my best advice.
Excellent. Thank you so much. For my other panelists, thank you again for your presentations. I learned quite a bit from what both you all shared. One thing that I noted across all of the presentations is something I think this group is very aware of, that it's just a small number of American Indian, Alaska Native representation across the health professions. But I did, find hope within some of the initiatives and things that you all shared, and wondering if you could share what has been the most successful collaborations that you've been able to nurture over time to begin to see any type of uptick or any changes within representation, or just a general awareness among the youth that you're working with.
I'll weigh in. I think that some of the things that we do, like with the podcast, actually I just identified someone, so we'll be doing a recording next month on Indigenous medicine and veterinary medicine, and we'll feature faculty from the US, New Zealand, and Canada. But those types of things where it's a high impact in terms of increasing knowledge, low risk in terms of, just kind of getting people to learn more, but also kind of preparing them and kind of saying, hey, this is really cool, really interesting information, and we want you to build on it. I would say outside of the US, the work that we've done with our schools have been way more successful than domestically. It's been really challenging. It's been really challenging in the US to really reach those populations. I put ACEs on, and had ACEs on my slide, but we also maintain a pretty committed presence over the last 20 plus years with SACNAS. And like, I go to SACNAS every year. Those students are there. They're there. They want to be veterinarians, right? We see them every year. I've seen students that, had started, like, were in their freshman year, and now they're out in practice, having gone to SACNAS for so many years, and now they're program directors and bringing students of their own. So those students are there. It's really reducing barriers in the application. And that's everything from making sure that they can get those experiential hours. Someone kind of mentioned that in the chat. We know that it's very, very difficult for our Native students to get those hours under the supervision of a veterinarian when the community doesn't have a veterinarian for hundreds of miles, right? And so it's really, really challenging. And so trying to work with our colleges saying, hey, they may not have a veterinarian, but they have farmers, they have ranchers, they know they are learning animal husbandry, they are really kind of getting the incredibly valuable types of exposure, but we have got to reduce the barriers. That's not reducing our expectations, but it is making, at least making the application and completion of the application successful and accessible to these populations. They are absolutely competitive, but if they can't get through the application because of really silly things that we know they can't access, that's a problem on our end. That's not a problem on their end.
Yeah, I think for us, obviously, you could point to the collaboration with Oklahoma State as a shining example of how a strong partnership like that can make a difference. But even in spite of that, we're not seeing a shift in the applicants and admissions that we would like to, because that's one small area. And so, you know, I know so many campuses, like in the Pacific Northwest in Yakima, there's a Roots to Wings program that goes all the way back to the early youth. And I think that is a continued focus of our profession, is by the time somebody is in their college career, they may have already written off a healthcare profession as a pathway. And we understand that getting to them earlier and exposing them earlier is important. So at Pacific Northwest in Yakima, they are working with the local Yakima community and the nation there, the Yakima Nation, to really get the youth exposed at a very early age of the possibilities of a healthcare career. And I think one of the big opportunities that we see is when you look at the map of where our schools are now, a lot of our schools are located in rural communities or smaller, not the big urban environments. And they're very near many of the different indigenous nations. And that opens up the door that if you are somewhere, look at the map of where our schools are, pick up the phone, call the admissions department, call the administrators at that institution, and introduce yourself, say who you are, what your role is, what you're trying to accomplish, and just open that door for collaboration and partnership, because I am confident that on the other end, that's going to be well received, because we want those types of partnerships as well.
Excellent. So thank you all for that. I've noted a couple of different things. One is working directly with the institutions so they have a greater sense of what are some of the key barriers that our students are experiencing, and so that they can take those things into account when evaluating their application, and noting, you know, all of the effort and the qualifications that these students have and what they'll bring to the profession. I've also seen within the chat additional consideration or encouragement for institutions to also look at holistic admissions and not just focusing on merit-based or, well, I wouldn't say merit-based, but just looking at the academic metrics is what I'm getting at there. And just overall additional partnerships. One thing I'll note from one of the previous presentations here, because we're talking about collaborations between our associations and the institutions and creating awareness there, but also that cross collaboration between the health professions as well. So one of the things that Dr. Rickert noted was sharing the different prerequisites and the similarities there with the students, so that if we encounter a student that may initially be interested in dentistry and maybe change their mind later, that we can direct them to veterinary medicine or to osteopathic medicine. So that's also a potential strategy there. I am going to shift to one of our audience questions. Kathy, you have the floor. You're on mute, Kathy.
I couldn't type the paragraphs, so sorry. And thank you. This has been fantastic. This really has. I'm going to ask each. I have stuff for each of you, so if I'll say it as quickly so I don't, you know, hog too much. First, Jessica, I had a dental student that's an artist. Teach that we do Zooms for kids and families, and I had her show the kids how to draw a tooth. So double hump camel, double hump camel, double, and then put legs on it. And then we used cardboard, paper, and tissue, and then they cut it in the same size. The kids were all over the country, and they dropped it in the water. And to see the difference between enamel, dentin, and pulp, one kid brushed his teeth 52 times after that. I said, but I wanted to ask you because I was just at the dental school today. My husband just had a periodontal surgery, and so in between starting this and racing back home, and I asked them if they had any posters or things. I'm hoping to go to the powwow, and they weren't certain exactly how to find some of the stuff. Would you, I would love to reach out to, I'll put my blurb in here, but I would like to get some things to take with me because I actually encourage all of the fields. Do you know what I'm saying? Because I'm also, I used to chair a coalition for science and math and engineering education for the state. So I've grown a lot of engineers too, but some do both, you know, medicine and engineering. But I would love to, I'll put my blurb, but I would love to, maybe you could help us with the Zoom or something like that. And then one last thing, I met one orthodontic dental student, and when I pulled them in to do, I was at Denver Indian Health to do a program for the guy that designed Spaceship One. I mesh all this together. He did a middle school, high school competition for 560 kids in Colorado, and that young dental student came to represent and helped with the after school science stuff. So I want to talk to you. And Lisa, if so I used to live on the Winnebago Reservation, and I started a health careers club. This is many years ago. I'm not 100, okay, but I graduated medical school more than 45 years ago, and AAIP recruited me almost 50 years ago. 4 of my students wanted to be vets. And what I did is I would take them to the university to see all the students, to different things. This was University of Nebraska out there, but I also went to visit for the 4 students' vet offices. You guys have fun. But one of the things, and I went back 30 years later, and all my kids on that reservation had gone to college, had 12 to 15 in there. I'd like to see if some became vets. But one of the things that I've run into a problem with is that you guys have less schools than the rest of us. And before, years ago, it was you had so few, it was so competitive to get into. And I've been wondering if you could give any advice. Like I've talked with kids about maybe even when you're younger, go do programs at a vet tech school, even in middle and high school, get classes that you, and tell me if this makes sense, because I've been preaching this, and to show stuff that you're really interested. If you can get on a research project, you know, help out so that your resume looks better than other folks. But tell me, because I run into kids all the time.
Yeah, that's a great question, and it seems intuitive, right? And yet what we find is there's a lot of friction in the sense that vet tech is its own profession, right? That is our nursing. And so there's a bit of a rub sometimes with some admissions committees with this notion of using kind of some of the vet tech programs as a stepping stone. That said, I absolutely think that for some populations, it's really probably one of the few pathways because there is such limited access to the professional, right? A direct professional, kind of a clinic, or even a large animal practice. And large animal practices are less likely to take students on because, frankly, greater physical danger. Like those animals kick, and it's a bigger problem than when your dog kicks, right? And so the short answer is yes, but I wouldn't tell them to take too many of those classes because it really does send a counterintuitive message, frankly, to the colleges. And so I say that it's a great starting point. And then really say within those programs, if they can identify a faculty member who also have connections in the community that can then maybe refer them to local veterinarians in whatever type of practice, even if it's a state or local public health practice that they think can go shadow. I think that is incredibly valuable in the sense of making those connections to kind of feed out of the tech program. It's a great place to start, but I would just say that some schools tend to frown on it. And honestly, vet tech students, they don't apply to vet school as often as people would think. Last year, only about 3% of our applicants were certified vet techs. It is its own professional path. And so yeah, some of that what would seem intuitive doesn't quite play out that way in the application process, but it is a great jump off place for students to find other veterinary professionals.
And I talk to them about not necessarily get a vet tech degree, but just getting a foot in when they're younger. Like I've used this to get engineers. Sure. You know, I've had them take programs at the community colleges when they're in middle school and things like that to get a toe in, or like if they want to
Sure,
do
absolutely.
space engineering,
Absolutely.
do airframe and power. And it's amazing to see this. And I did a stint with the Royal Flying Doctors in Australia. I didn't realize you had a program like that. That's too cool.
Yeah.
Thank you. And Rance, and I'm sorry, I don't want to hog for people, but I'm just going through. Now, I like that combination. We have a new program out here, Rocky Mountain Vista and whatnot. And I actually was recruited. They were looking for a dean at one point. I founded the other program that didn't come up here. I was a founding director for the first family medicine physician assistant program in Colorado. And so that's another area for people to tell their students about. You know, they do 80 to 90% what your family doc does. But are there some advice things that you would say to better prepare your students with that combination, you know, that would help kids get further into osteopathic medicine? You know, that saved my cousin's mother at 60 went to osteopathic medical school and practiced into her 80s because she got tired of the junk that was going on in routine medicine. Do you have some other suggestions? And then I'm going to shut up because other people want to ask questions.
Yeah, that's a shining example of something that I think our profession has embraced, is the non-traditional student, the non-traditional pathway. All too often in our country, we've programmed our youth to think that they have to go to, you know, through high school, go straight to college and get through college in 4 years and then immediately go to a professional school or you know, if that's their pathway, and graduate, go to residency, go straight to practice. Our profession is made up of a lot of students who go out and experience the world in a different way. The average age of ours is a couple of years older than some of the other healthcare professions, because we do have students that are taking time off and seeking those life experiences, or maybe realizing that they ignored their calling or their passion for healthcare and they pursued some other degree pathway. And so one of the things that we're working hard out there is to identify those career changers and how do you reach them, and that messaging of it's never too late to pursue your passion, whether that's at 25 or 60, it's never too late. And we encourage them at that point, you know, they may need to go back and get their prerequisites that we talked about, but those prerequisites, again, are common across many of the programs. So go back and get those. And at least, if nothing else, you're broadening your knowledge and you're opening up those opportunities to pursue that career. I see Jessica looks like she has something to add to that.
There's, for the students that might pursue a dental career, the two dental schools in Michigan, they do have open houses, and all ages go to these open houses. You see little kids, 5, 6 years old, running up and down the halls, and you see parents and grandparents. Now, when I go to the powwows and I hand out information on how to become a dentist, yeah, I get some 14, 15-year-olds that will, you know, reluctantly take it. They want the toothbrush and stuff, but they'll take it. But the parents and the grandparents, they are very interested in what I'm handing out. So these dental schools have open houses, but not every state has a dental school. But check it out. And then if you have your own private dentist or a dental clinic at your tribe, talk to that dentist. And as we are developing this hygiene recruitment program, talk to your hygienist. Hey, what made you decide to become a hygienist? You know, how do you like, how long have you been a dentist, and how do you like working at the tribal clinic or your private office? I mean, I had my own private office, and anybody that asked me questions like that, I would be more than happy to talk to them or have them come after hours or maybe over a lunch break or something like that, show them around the office. Hey, this is what we do, and this is how we impact the health of our patients. So talk to your own dentist or your own hygienist. And also the American Dental Association, they have affiliate associations in every state. Of course, I'm talking about the Michigan Dental Association, but on the Michigan Dental Association website, there is a career button. So if you press that career button, it will give you lots of information about becoming a dentist in Michigan. And the American Dental Association has a career button too. So you can even call and they will set you up with, in Michigan, this is the way it is. They will set you up with a mentor dentist if you want to become a dentist and you don't have access to that. So your dental schools in your state, your own dentist or your own hygienist, and your dental society in your state. Those will be 3 places that our students can reach out, because there are very few American Indian dentists, and I can't talk to every single student, thousands of students, so I need help, and these people have offered to help. So those are.
Do you have the student, the one student that drew from, she's now graduated and she went on, and I'm trying to recruit more to help out. Do you have, there's a dental, similar to the SMA, there's a student dental association you mentioned, and is that a nationwide?
Yes, that is a national student, American Dental Student Association, and they have state chapters. And then in each school, they do have school chapters where they will have, I guess you would call it like a pre-dental club.
Okay.
So students that are thinking of going into dental school, of course, often these students are children of dentists. That's really common. But there are also, in my family, there weren't any health professionals and they didn't have a club like this. So if they had had a club like this, it would have really helped. This is what the dental aptitude test is. This is how you get through organic chemistry. It would have really helped. So they do have these, at most large universities, they have the American Student Dental Association. Most of them will have a club like that, yes.
Thank you, everybody.
We are coming up close on time here. And thank you all for sharing such wonderful resources. What we'll try to do is maybe collate all the things that you all have put within the chat so that we can share it out with our larger iHeart network here. And also just continue this dialogue with all the health professions. I think we have a lot we can learn from each other, whether it's some of the innovative things that veterinary medicine is doing with the podcast. I could see myself as a dentist initiative, even learning from the establishment of the tribal affiliated medical school. I think we could all can take away some lessons learned here. So thank you all for your time and your presentations. We're hoping for continued engagement.